On January the 4th of this year, I was out cutting firewood, and I had finished cutting one piece of wood, and I was trying to decide where to go to next, and all of a sudden the chainsaw was jerked out of my hands, and I saw it flying through the air up over top of my head, and it landed, I don't know, 8 to 10 feet away from me. And my first thought was, oh, I lucked out, it didn't get me. But then I happened to look down at my hands, and I could see a cut in the back of my leather glove, and I could see blood. I don't know, because it happened so quickly, and I didn't even know my hand got cut. I think the chainsaw, the chain was still running with it in my hands, and I think it just hit a small sapling tree, and it just jerked it out of my hands, and then it, like I said, it went way up over my head, and it was all in slow motion. People say it doesn't happen, but it was in slow motion because I watched it fall down. I knew it was not a light injury. It was very severe because of the bleeding and what I could see of the injury. I knew it wasn't good. And so they rushed me inside the emergency room, and then they came back and told me that they would have to send me to Indianapolis. Dr. Peck from the Indiana Hand and Shoulder Center would be doing surgery due to the severity of the injury. And then they had to go back for a follow-up the following week at the hand center, and they gave me a list of therapists to choose from because I needed to have quite a bit of therapy on my hand, and it needed to be a certified hand therapist. And the hospital here was on that list, so I called to see if they would accept my insurance, and they did, and I said, make me an appointment. So that's how I got to meet Sadie, and she started giving me the treatments.
When Lee came to me, she had quite a severe injury. We knew we had a long road ahead of us, and I told her that from day one. At that time, we were very limited on what we could do with Lee due to the need to protect the repair that the surgeon did. With being able to provide one-on-one care here at Schneck, you really get to know the patient. You get to learn about them somewhat on a personal level. We talked a lot about her work tasks and what she needed to do to be able to return to work. That's in addition to just basic self-care. That's important as well, but when you're one-on-one, you really get to know your patient.
Sadie and I hit it off real well the first day because she wanted to know some of my background and what I did, and I told her I farmed, and so then she gave me some of her background, and she came from a farming family also, so she understands the different challenges that you have and the tasks that you have to do. So she was, giving me exercises so that I could accomplish those goals. And then within the last, 4 or 5 weeks, she said, what kind of things can't you do? And there was just little simple things like I can't put my hand in my pocket because that finger was stuck way out, and I just couldn't get my hand in because it was sticking out. And so she gave me some exercises where I can get it to come back in, and now I can get my hand in my pocket. And then the other day I said, I had trouble pulling sweet corn. Well, if a therapist didn't have farming background, they would have no idea how to pull sweet corn. And Sadie did, and she started giving me some different exercises to do. It was in my wrist I was having trouble with because the wrist didn't move either while it was in that splint.
Lee has been very compliant with the instructions that I've given her to do at home, including caring for her scar. We are fortunate here in the Rehabilitation Department at Schneck that we have certified wound care nurses on site. So with Lee's severe injury and requiring a lot of wound care, even in therapy, I was able to collaborate with them on the best wound care techniques to allow her wound to heal. As you can see in some of those pictures, you can hardly even see her scar. She's probably the worst injury I've had with a chainsaw. The fact that she ruptured as many structures that she did is pretty severe, quite severe.
That little finger still doesn't stand up perfect, but it's pretty functional. Even my surgeon told me, says, a straight finger is not as important as having your function, the workings of your hand.
Her motion is not 100%, but due to the severity of her injuries, the progress she made is phenomenal. She has a very functional hand. She can do most of her basic self-care tasks. She can complete her her job tasks, she's still wearing orthoses and doing different things at home to try to get that last little bit of motion. Overall, she's done excellent. We hope you stay injury-free and never need us, but if you do, tell your doctor you choose Schneck Rehab Services.